From Eyewitness News, this is Newsmakers.
The implications for Rhode Island are huge. The parent company of Women and Infants, Care New England, is looking to join forces with healthcare behemoth Partners of Boston. But the president of Brown University is sounding the alarm.
If healthcare in Rhode Island weakens, it's bad for all of us. It's bad for the medical school, and most importantly, it's bad for consumers.
This week, the argument for partnering with partners. Our guest on Newsmakers, the president and CEO of Care New England, Dr. James Fanale. Welcome to Newsmakers. I'm Tim White. Coming up on the second half of the program, we will have Lynn Arditi, healthcare reporter from Rhode Island Public Radio, to talk all things hospitals and healthcare. But for now, joining me on the program, WPRI.com reporter Ted Nesi. Dr. James Fanale, CEO and President of Care New England, thank you very much for joining us on the program.
You're welcome.
Just so our viewers know, Care New England, as I mentioned, is Women and Infants, but also Kent and Butler Hospital. Look, Dr. Fanale, this is not my beat, in full disclosure, okay? So everything I know about this I get from Ted Nesi and Lynn Arditi in their fine reporting. So my questions might be very basic about this, but I think they might be a lot of the same questions our viewers have because they're not as into it as everyone else at this table is. My first question to you is, if the Care New England Partners proposal comes together, can you guarantee sitting here right now there will be no job losses following the transaction?
You know, that's a tough question to answer at this point in time. We really don't know what the transaction is going to look like. You know, I think that the preservation of a lot of the most jobs will happen through the transaction, okay, because all the healthcare jobs are local. We don't see any of that changing. But in terms of other things, in terms of governance, we're not sure. So, you know, today I really couldn't give you a definitive answer. But I think the vast majority of healthcare jobs say the ones patient care focused, the ones on the lines, taking care of patients in the hospital, et cetera. So that's the best answer.
The concern would be more on the administrative end.
And the administrative end, again, we haven't really even looked at all that stuff yet. I mean, what kinds of things can you consolidate? I mean, it's all about how do we deliver care at the best price, right? So what I've always been concerned about in all the job issues is to make sure that we have as many frontline direct care workers that we can. So I've never been one that has wanted to limit the number of, I would call it direct patient care people. On the administrative side, if there are less administrators, it doesn't affect the health care that we provide to our patients. So I don't really know what that's going to look like.
You announced about 2 weeks ago now that Care New England Partners would pursue the merger. You decided to go forward. You were going to negotiate. It's called a definitive agreement. It's kind of the core deal between the two sides, how things would work. How are those talks going at this point, 2 weeks after the announcement?
So pretty well. We've had a couple of discussions where we're beginning to form the basis of what that definitive agreement. The definitive agreement is the deal. What's in there, and so we're working through those things. The definitive agreement, I think, will encompass what's the local governance going to be, which everyone's concerned about. Will clearly speak to the primacy of our academic affiliation with Brown, and it'll talk about how's the structure of the agreement going forward. So I think those are really the important points.
Do you have any sense now of how soon you think you'll be able to make that public and announce it?
Well, first we have to get it done. So the question you really want to know is how long it's going to take us to get this done. I think within 60 days or maybe 90 days we'll get it done. There's a lot of discussions going on now as to how do we get there. But I think we'll come to agreement pretty quickly.
You know, Tim mentioned at the top the concerns, and you sort of alluded in there, Brown University's president has been expressing lately. One of the things she said when I sat down with both of you last week is, will there be, she wants to see core commitments in this agreement that lay out in detail what Partners is committing to do in Rhode Island, maybe, I don't know, financial amounts of money or specific metrics to guide that. Do you expect that kind of detail to be in here?
So I think that some detail will be in there, but again, not looking even at draft yet, it's hard for me to say for sure. But actually, I met last week with the president of Brown and the dean of the medical school. We went through some of those things that are their concerns. Now, one of the concerns is that healthcare services will leave Rhode Island. We looked at some examples about services at Women and Infants. We can assuredly say that those services are not going to leave. We're not going to close things down from day one. So I think we could assure people and assure her that those things are not going to occur. And then the issue is what's the local governance going to look like? So I think we can actually, even if it isn't definitively stated in definitive agreement, that we can commit to certain things that will satisfy their concerns.
How do you think the meeting went?
Very well. It lasted an hour. We got in and out of it. We walked away friends. We're still friends. We're going to meet again. Listen, Brown is our academic affiliate. That's not going to change. And we really want to make sure that we work closely with them. So our faculty are concerned. Everybody, I think, wants the right thing. But what we're concerned in making sure we can deliver health care to our community and take care of our patients the best way possible. And this is what we think will work.
Well, why don't we hear from Brown University President Christina Paxson? As Ted said, he sat down with her last week, and I honestly don't know if that interview happened before or after your meeting.
Before.
Okay, so it happened before. Why don't we listen, play a clip from her, and I want to get your reaction to what she has to say.
But then the question is, well, what happens next? And the story that you hear from a lot of people is that you have Yale New Haven coming up from the south, you have partners coming from the north, but you could imagine in 10 years a situation where none of the major hospitals in Rhode Island are controlled by a Rhode Island entity. And I don't think that would be a good place to be.
That was Brown University President Christina Paxson with Ted Nesi last week. What's your reaction to that?
I mean, it's tough to gauge a reaction because one of the things that she said was you could envision that the Rhode Island healthcare systems won't be controlled by a Rhode Island company. I don't know what that really means, except that our goal for what we envision is to be a stronger healthcare entity in Rhode Island. If you look across the country, this is not uncommon that these kinds of amalgamations occurring throughout the country. You know, I would add, if you look at the relationship that Brown is looking at with Prospect, Prospect's not a local company. And
but Brown very much is a local institution.
But Prospect is not, and Prospect as a for-profit, I think there's much more, it's much more solidified as a not-for-profit system than a for-profit system. Because a for-profit system could change things or change ownership in the middle of the night. So these kinds of amalgamation, I think, in the not-for-profit sector, especially this one, works better for our citizens.
Just to keep people up to speed, that's Brown, we haven't alluded to it, but Brown's sort of plan B they'd put forward where they'd work with Prospect Medical, the Roger Williams owner, as a different takeover for Karen.
It's a different takeover. So I think that it's all, what's most important, what's the best health care for the communities you serve. And if this relationship, which we believe is the right one for Care New England, allows us to do a better job taking care for our patients, and they're not that far away, I mean, they're just 45 minutes away, I think it still emphasizes local health care.
The other institution we really haven't talked about here is Lifespan. Lifespan was also wanted to partner with Care New England and merger there. That didn't happen. I got to tell you again, just from reading the coverage, the perception on my end from the cheap seats is that Care New England and Lifespan, they are not getting along right now. Have you met recently with Dr. Tim Babineau, the president and CEO of Lifespan?
Yes, I don't know where you get that they're not getting along right now. I met with Dr. Babineau last week. I saw him Tuesday at another meeting. I think we get along fine. I think what we have pledged to do is that we're going to work together to try to do things that serve the patients that we all jointly care for and try to work together in a positive relationship. So I wouldn't say that the relationship is bad at all.
What about Neil Steinberg, head of the Rhode Island Foundation, had an op-ed that got some attention, arguing Rhode Island leaders should come together to discuss building an academic medical center. It sounded like, though he didn't get into specifics, another discussion of bringing Care New England and Lifespan together under one roof. The idea being you get rid of some of the duplication, the multiple contracts that have to be done when there's working together stuff. What do you think of all that? People have been talking about that for years now in Rhode Island.
So I think sometimes it's not always the what, but the how. And so I try to talk to Neil this week about this. I think structurally it's going to be really hard to bring all these three together under one unified business structure. I actually
Lifespan, Brown, Care New England.
I think that's never going to happen. And I think there's enough evidence out there to support that would be very, very, very difficult to do for multiple reasons, which I won't go into. But I do think that there's got to be a way that Brown, Care New England, and Lifespan, which are the three biggest pieces of the academic medical world around, can come together in some kind of a relationship to do just that. No, I mean that, and we've had some discussions about trying to have that discussion. I think Care New England has worked very well with Brown. We're fostering a new relationship with Lifespan. I'm not so sure we couldn't figure a way to try to synthesize all the teaching programs somewhere together to satisfy that. I just don't think structurally it's going to happen. And if you notice in the op-ed piece that Neil did, he didn't describe exactly what. He didn't take a position about who should do what or where. I think it's worthy of the discussion, and I had that discussion this week with a couple of folks.
It's clear that Brown at least will, to some extent, be, maybe lobbying is too strong, but may be encouraging state leaders to consider rejecting the deal, regulators who in the end will have a say on this. Carolyn came into this because you'd had some financial strain in recent years. What would happen to Care New England if you try to go through with the partners deal, you get an agreement, you go through months or however long it takes with the regulators, and they're like, nope, sorry, you're staying independent?
Good question, but let me first point out that there are a lot of people that want us to do this, okay? We've got 7,000 or more staff, physicians, probably more than that. Our unions that we have a very good relationship with at both Kent and Women and Infants and Butler are steadfastly supportive of doing this relationship with partners. So we think we've got a really lot of support for doing this, and we think it's going to bring new services to Rhode Island. It's going to really create a better model for care, and I can give you examples of that later. So we really think there's a lot of people in favor of this, and I think they're going to speak out in favor of it. That said, Care New England's financial performance is back on track. As I've told you before, our goal is with the what we call the obligated group, which was once Memorial is on the side, is going to perform at break even or better this year. So the question they were asked is we will continue to perform, because our goals this year has been to turn the ship around, improve our financial performance, and then, only then, would we be able to contemplate an arrangement like this with partners. And that's what our pledge to our staff has been. So we've been able to do that. We're better than break even. We'll continue that performance throughout the year. If for some reason the deal didn't happen, and we feel very strongly it will, we're going to be okay.
I want to move on to something else, but if the regulators, as Ted pointed out, say no deal, we're stepping in, are you going to fight that, and what does that mean? Do you take it to court? Do you sue the state?
Boy, you're asking a tough one.
That's what they pay me to do, Dr. Fanale.
We don't even have a definitive agreement signed yet. I don't know. I really think that what we're going to do is proceed to get the definitive agreement accomplished and go through the regulatory process and make a case for why this is the best thing for Rhode Island and our patients, and I think we'll succeed in that.
All right, I have a flu season question for you.
Okay.
You know, everything we're seeing, really bad flu season out there. You're on the front lines, your hospitals are certainly. What's it like inside your hospitals right now?
You know, we had a really significant blip in inpatient activity for the flu season in early to mid-January. The ER is beginning to roll again. I mean, the important thing about the flu season clinically is, you know, there's not much you can do for the flu, okay? What you really worry about with the flu season is patients that have other problems, like chronic lung disease and heart failure. Those are the people you worry about. We certainly don't want people standard flu healthy like you, which I assume you are.
I hope so.
You don't want to be running the emergency room, running with the flu to the emergency room. I think we have a big public education challenge in informing folks, here are the standard symptoms of a flu. Don't really need to run to the hospital, the emergency room for that, because basically what happens then is you're giving it to everybody else. And we need to educate who is really at risk. That's why this flu vaccine thing is so important, because in older folks that are sick and at risk, it decreases their chance of being admitted to the hospital and actually dying. So I think it's probably on the uptick again. There's been sort of a bimodal wave. We're handling it pretty well. Our ED volume's gone up a little bit. But the real impact on inpatient admissions was earlier in the month of January.
Has it been difficult for, especially we did lose the Memorial ER, which was closed late last year. Has it been a challenge for the hospitals that remain, especially in sort of the Providence area where the bulk of the population is?
I think that the director of the Department of Public Health came out and said that the EDs are overburdened now, and it's really the flu season. Well, you could contemplate or extrapolate that if Memorial was open, there would be more flu patients in the emergency room. But I still think a lot of folks are running to the emergency room that you really can't do anything about this disease, so you would hope they wouldn't overburden the ERs. Miriam's been overburdened, Rhode Island's been overburdened, and as is Kent. but we've been able to handle it.
All right, Dr. James Fanale, CEO, President, Care New England. Thank you very much for joining us on the program. We hope to have you back in the near future.
Happy to do so.
When we come back, Lynn Arditi, a healthcare reporter for Rhode Island Public Radio, will be joining Ted and I to talk all things hospitals and healthcare. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. To my left, WPRI.com reporter Ted Nesi, and joining us on this healthcare roundtable, if you will, Lynn Arditi, healthcare reporter from Rhode Island Public Radio. Ted and Lynn, first of all, great job on your reporting on this topic. This is, as we saw with Dr. Fanale, there's a lot at stake in this. And I guess that's kind of my question to the both of you. For the people at home who sort of aren't following it very closely, why is this such a big deal when we talk about Care New England, possibly partnering with partners? Why is it a big deal?
Well, Care New England is the second largest health system in Rhode Island, second largest hospitals. If the concern is if they get together with partners, are bought by Partners Healthcare, which is based in Boston, that the center of our care is now moving out of state, that there's less control over it, that maybe specialty services might move out of state, that even some of the residency programs that train our doctors through Brown might also move out of state. And what does that do to the people who get care in Rhode Island and the people who teach them, the teaching system here? So what happens if they start moving things out of Rhode Island?
Yeah, and it has implications across different parts of people's lives, different areas. What we think of as maybe unrelated or directly related here, patient care, as Lynn says, which doctor you go to, which procedures are available, how much of those cost. Healthcare costs are a huge issue right now all over the U.S. and it's very much here in Rhode Island. Also on the economy.
Right. They're a big employer.
The research that is done at these places that can lead to spin-offs. The employment of your first question to Dr. Fanale, he acknowledged you can't promise that every job that's currently at Care New England will be there in a partners version, and in a way that you'd expect that, right? They already have a lot of people doing administrative stuff in Boston. Why would they want to duplicate that in Providence or Warwick or whatever? So it just has enormous implications as well because, it's really a generational decision, right? You're not going to have a do-over in a couple of years and say, well, maybe Rhode Island doesn't want to let an out-of-state company take over. And maybe that will be the best decision. That's not for us as reporters to decide, but it's certainly something people should take seriously because it's really a one-time chance for the state and state leaders and residents to debate kind of which direction do we want to see our hospital system go in.
Lynn, I was really struck when Brown University President Christina Paxson came out very vocally against this, or raising questions, I guess is probably the fair way to put it. And I'll tell you again, from the layman's perspective, my view was, well, she's just worried that Harvard, which is, with Partners Healthcare in Boston, is going to come and Bigfoot Brown University and the Alpert Medical School. Do you think that's her concern here?
Well, I can see why that you might have that impression, but after talking to people, I got the sense that they were really upset that in Boston that Harvard has not gotten sort of a bigger priority with partners, that they feel like they're not getting the attention. And I think the feeling among the academic community here is if Harvard, their primary university medical center, is not getting the attention, then what's going to happen to Brown?
Boy, Ivy League egos is what we're talking about here right now. That is a dangerous and big. Were you surprised, Ted, that Christina Paxson, again, president of Brown University, was so vocal about this?
Yeah, I think the Brown's handling of this whole thing in recent months has been striking. Brown, there's a reason we say the Ivy Tower, right? You usually you don't think of academic institutions, especially ones like Brown, getting as involved in the muck of this kind of thing. You had Brown actually actively try to put together the Plan B we alluded to earlier, a different option for Care New England after they announced the Partners deal, working with Prospect Medical, which has its own controversies. They're a for-profit. Right. They don't have great relationships with one of their unions here in Rhode Island. They've gone with that. And just coming out and saying, Christina Paxson has not really sugarcoated her perspective. I would say she said in her first essay statement on this, I don't think the Partners deal is good for Rhode Island. She didn't leave any ambiguity there. So Brown is whether they're really trying to block the deal or just trying to make sure partners, it's clear to them they have to take some serious steps to keep Brown from making a lot more trouble for them down here. They are very much using their influence, which is significant. Go ahead.
I was going to say, I think it's more than an academic issue. If it were just academic egos, you wouldn't have heard the governor stepping in and saying, gee, we think that we're glad to hear that there's another option here. And so I think that really speaks to the weight of what's at stake here with Brown. Brown has a huge effect on our economy. It is another sort of engine of economic development. And every time there's a grant for Women and Infants Hospital, say you have a $10 million grant for research. Well, in addition, if you get that grant, as much as like $7 million in addition to that comes from the federal government to Rhode Island for administrative fees and other costs. That creates jobs. That's another economic engine. So it's an engine of economic development, and I think Governor Raimondo realizes that. So that's why I think you've also heard her kind of saying, hey, this is something we should think about.
So the fear would be then, Lynn, that the grant would be more watered down if it's going to partners out of Boston than it would be spread out a little bit more as opposed to focused here in Rhode Island?
I don't know if it's the particular grant or it's that in order to have the support for research and to have that the ability to get those grants and to have the funding behind it, you really need a strong hospital institution behind your
and of course, that you can also zoom out a little further and say, it's not like, I don't think there are many people who think the current situation is perfect either for academic medical work in Rhode Island. As even Dr. Fanale acknowledged there's a real bifurcation when you have, it's so funny, Rhode Island Hospital and Women and Infants share a campus but are two different companies. They have a 99-year lease, Care New England, with Lifespan on that.
And they have to go through the tunnel.
Yeah, you have to go exactly.
Through the tunnel, yeah.
I didn't realize, maybe I should have, but until I did the story last week that those interviews came from, that when they do one of the projects Lynn is talking about that involves a Lifespan researcher, a Brown researcher, and a Women and Infants researcher, they have to actually sign subcontracts with each other each time. So you get the grant from the federal government to whoever's the lead, and then Care New England signs a side deal with Lifespan on who's going to share the money and where things go, and Brown signs a deal with them. I mean, that's a lot of paperwork and administrative and sort of just gumming up the works that you can imagine. You multiply that over hundreds, thousands of people over years. That is something that could really hold back the ability to easily do those kind of innovative research efforts and things that we're always hearing the governor and other people talk up as the future of the state economy.
Dr. Fanale in the first half of the program seemed a little shocked that I would even ask if there was a little tension between Lifespan and Care New England. Am I wrong here? I mean, there seemed to be some
frustration. It's like the gambling in Casablanca. Yeah, who would ever guess?
My stars. But Lifespan seemed, from what I read, frustrated when they were rejected with the deal. Is that perception wrong?
Yeah, no, I think that Lifespan has coveted for a long time a Women and Infants Hospital in particular, and I'm sure they'd love to have Butler as well. I mean, Lifespan went out and made its own proposal to open an OB unit, and people were almost saying, oh, come on, what are you thinking here? We've got Women and Infants. But I think that sort of speaks to their frustration with not having sort of the control over their own OB unit. And Care New England has not wanted to give in and have some sort of a partnership. I think neither of them. I don't think that's been a mutual sort of stalemate between the two companies. And for the providers and for the patients, I think in a lot of ways we could see a lot of benefits of having one system.
It even comes down to board seats have been an issue in these negotiations where there have been talks to bring them together. How many of the Care New England, how many of the seats on the new company's board would go to Care New England people versus Lifespan people who would have control, who would be, you can call it ego and there's ego, but there is also just a real sense of different priorities and, what people want the next steps to be with these companies and what direction they'll be and who controls it. It's important stuff, but we've now been talking in Rhode Island for at least 20 years. I mean, I think the first Lifespan Care New England big merger attempt was around 1999. So this is a 20-year sort of back and forth, multiple governors trying and failing to make it work. And now it may be that sort of the partners deal is it's like musical chairs, it's calling time.
Lynn, we have just about a minute left. So I wanted to ask you about a story that you broke recently about some people in Rhode Island are considering safe injection sites. What does that mean?
Well, safe injection sites are literally safe places, people where drug users can go who are IV drug users and actually inject the drugs without fear of being arrested, prosecuted. This is something that's been done in Europe and in Canada since like the 1980s, I think. It's something that is being invested in California. The state has recently provided money to do this. And the reason is it's all about harm reduction. And what that means is that if we can't stop people from using drugs right away, we can at least reduce the harm in the population. So like with giving people clean needles, you know that they're going to use, but if you give them clean needles, you can reduce the spread of HIV/AIDS infection. And that has been hugely successful in reducing in Rhode Island the spread of HIV/AIDS. So they're taking that same model and saying, okay, we've got an opioid epidemic.
Question
here.
is, of course, what the federal government would do. We're just about out of time, but
Right.
there's, of course, federal laws that would have to be grappled with there. Lynn Arditi from Rhode Island Public Radio, great job. Thanks for coming
Thank
on.
you.
Ted Nesi, thank you very much. If you missed any of it, it's online, WPRI.com. Ted and I will see you next week on Newsmakers.